discuss today? Discuss today is, I'll just share a small case, a very interesting case. Have a look, concentrate. Now what do you see here? I'll show you another image. What do you see here? Huh? Very good. You see eruptions. Beautiful observation. Okay, eruptions which has some discharge. Good. Agreed. Okay, you can see some inflammation. Yeah, good. Huh? Okay, fine. You can also see some skin lesion. And where do you see the skin lesion? Very good. Typically, the skin lesions are seen on the tip of the fingers. See, he's a gentleman aged around 70 plus. Okay, we will not go into the name and further details. Now, this gentleman was almost treated for 1 to 1.5 years, and before coming to us, he had tried lot of other system of medicine. He had applied ointment, he had applied steroids, he had gone to Ayurveda also, but unfortunately it would reduce and would again flare up. That's when he came to us. See, when he came to us, he first went to my wife, she treated him for some time, it would beautifully disappear, again it would come back. Then my wife said, why don't you meet my husband? We have this simple adjustment. My failures I refer to my wife, and before we refer to somebody else in the family, we just refer to each other. Okay, so that we don't miss the case. Fine, no. Okay, don't worry about that part. But what I am trying to tell you is, we definitely refer to each other so that if she has missed or if I have missed, we try to look at the simillimum. So this gentleman came to me, and he was in a very bad state. Now, why bad state, and what made me prescribe that particular remedy? I also prescribed 3-4 remedies. Unfortunately, no results. Okay. Then he was in such bad state. Why I was trying to tell you about the place, location where it is happening. It was happening over the fingertips. He was so frustrated, that he can't button his shirt, he can't literally wash, fine, seriously, and he can't take bath, he can't eat. Max wife mixes the food, he takes a spoon and eats. He was in a very bad state. To the extent he felt, sir, I want to die. See how simple the image looks. Huh? And many of you might be laughing, for a skin lesion, why this man want to die? Now this is his plight, this is his story, where he is so fed up, and he says, sir, I don't want any treatment. I have tried yours, I have tried your wife's, I have tried somebody else's husband, somebody else's wife, all we have done, and I am fed up, and I want to die. That is the state he had come to. And at this stage, I had prescribed a remedy. Can you make out? Okay, I'll show you another image. Same person, same hand, same fingers. The results were beautiful after the remedy. Now, why I gave this remedy, what is this remedy, is what we are going to discuss after some time. But can you appreciate the fingers? Yes. You may still see some slight mark which disappeared. It's a different thing. But this is what a right homeopathic medicine can do. But why did I arrive at this remedy is very, very important. And we had already done carbons. It's already there in the YouTube. Okay. General indications or group characters of carbons we have already uploaded. Now what you need to understand here is, what are all the common group remedies we have from the carbon group? Carbohydrates, animalis, petroleum, creosote, graphites. Yeah, common. I am talking to you about common. See, this gentleman was prescribed petroleum. This gentleman was also given graphites, because if you see here the discharge, very sticky discharge, and if you see extremities, eruptions, hands, tip of fingers, you have petroleum. Even that was tried. Constitution was given, and in the end we came to some specific remedies. That also failed. and that's when the patient gave up. He said, I don't want to live anymore. Okay. Now we'll look at this state a little later. Now you have given me a lot of carbons. You have given all the 4, and somebody also told of creosote. Creosote was the remedy prescribed to this gentleman. Okay. So now why creosote is what we'll try to explore a little later. So in today's class, we will try to discuss, or we'll try to understand what creosote is all about. So one basic information you all have got is creosote is a carbon. Okay. Now creosote, the preliminary information, it is a product of distillation of wood tar. Must be in pharmacy, they would have mentioned. And it was introduced by one Mr. Teste, and it's a very deep acting and anti-miasmatic remedy. Okay, it's a deep acting remedy. So this is just the introduction. Now next 40 minutes, what exactly we are going to do is very important. So I have few headings for you. I'll be telling you the pathogenesis, where exactly the creosotum will be acting. That is the pathogenesis, first part. And we look at the ailment storm. What are all the causative factors in creosote? Okay. And third thing, we'll be looking at the physical appearance. How do they look? And the last part is we'll be looking at the characteristic symptoms. So 4 small components we'll be discussing in today's class. Hope my agenda is clear. Okay. So we'll quickly look at the pathogenesis. See, if you have read the group characters of carbons, I don't know how many of you have gone through. Any wild guess where exactly the carbons act? GIT? Okay, it acts good. It acts on the glandular and the lymphatic system. It acts on the GIT. It acts on the extremities. It acts on the skin. Very good. Any other area we have missed? I told you it's a deep acting remedy. Fine. And you see this acting from head to toe. But we are focusing on the predominant area where creosote affects. Okay. First area is the mucous membrane. Okay. First area is the mucous membrane. From the knowledge of anatomy, you have mucous membrane in various parts of your body. Creosote has a special affinity for GI. Creosote has a special affinity for mucous membrane of the genitalia, okay, and the respiratory tract. So each remedy, based on its miasmatic background, can cause different things. Now what do you expect in general? What will a remedy do acting on the mucous membrane? It can either cause inflammation, very good, or very good, ulcers. Inflammation and ulcer, there is something in between. Inflammation, absolutely right. Mucous membrane, inflammation. Okay. Okay, induration. See, there is something called as growth. So majorly 3 things can happen. One is inflammation, the second thing is growth, and the third thing is ulceration. Psora is inflammation, growth is psychosis, and ulceration is destruction, which is syphilis. Now many carbons, they are mainly psychotic. So when they are psychotic, what do you see? You see more of growth. Fine. But creosote is a remedy which is predominantly syphilitic. Now this is the miasmatic difference between other carbons and the creosote. Okay, it is predominantly syphilitic. Carbo animalis, graphitis, they are more psychotic. So creosote acting on the mucous membrane, it will cause inflammation and ulceration. It is more sorosyphilitic. It is more sorosyphilitic. Clear or any confusion? Okay, good. So the second thing, probably we missed this. One more very important area where the carbons act is the blood vessels. Okay, the blood vessels. So acting on blood vessel, what will creosote do? I don't know how much of miasms are over in third year. Okay. No, yeah, they'll do. Don't worry, they'll do. Your organ teachers will start miasm. That's not an issue. But what you need to understand is, this being more of a syphilitic remedy, acting on the blood, it will cause degeneration. It will cause destruction. Okay, RBCs gets destroyed. So you see more of degeneration and more of decomposition or more of destruction of blood. And naturally, the end result will be anemia. The end result will be anemia. Okay, Carboveg is a beautiful remedy for anemia. So is creosote. Okay, so blood vessels, and one of your friend was telling glands and the lymphatic system. Glands and the lymphatic system. This is a very important area. Carbo animalis, carbo veg, petroleum, graphites, and of course creosote, they all act on the lymphatic system. Acting on the lymphatic system, it will cause discharges. Okay, and the discharges in creosote specifically is more acrid and foul smelling. Okay, so the discharges are acrid, I will tell you a little later, and the discharges are foul smelling. It smells bad. We will look at it a little later. And the last area I want to focus here is the female genitalia. Acting on the female genitalia, creosote will again cause acrid secretions, meaning the leucorrhea, okay, in creosote can be acrid. Okay, so this slide is a very important slide, and it will tell us where exactly creosote is acting. Any questions? So please go through the general characters of carbons. If you go through that, then this lecture will become very, very easy. Done in there? Okay. Now the second component is, how do they look? Don't look at these parts. I've just got this to distract you. But you need to concentrate here. How exactly a creosote person looks? Very good. They look lean, they look thin, they look emaciated. Beautiful. Okay. Now this is what you also need to understand. Majority of the carbons, majority of the carbons, they are obese. Carboveg, graphites, they are all obese. This is the only carbon which is lean, thin, emaciated. This is a very important point. So tomorrow you decide that this particular patient belongs to a carbon, and you will be shocked to see he or she is lean and thin. Please don't give carboveg or graphites there, or some other carbon. Based on the other symptoms, if they agree, you can think of creosote. Lean, thin, emaciated, old women, overgrown, poorly developed children. Children, they suddenly grow fast. They are too tall for their age. Okay? If you look at them, you might think they are 13. But if you ask their age, they might be 9. But they are tall for their age. Fine? Now in creosote, though they are tall, they are very poorly nourished. They don't have those muscles. They are very lean, thin and emaciated. This is creosote. Okay? Old looking children. Children who look old. Any quick remedies here that you would like to compare? Very good. Argentum. Argentum is a person who looks old. Why do they look old in argentum? Why do they look old? Dr. Allen's key Materia Medica, first sentence of argentum, he says they are mentally so much exerted. There is so much of mental exertion that it is acting on the body and they look old. You are getting my point? So when you have a person who is mentally overexerted, mentally too much stress, and that is showing on his body, he is 30, but for you he looks like 45. Then the remedy could be argentum nitricum. Okay? Lycopodium, premature balding, premature grey, premature old looking. And what remedies come to your mind here? Children who grow suddenly tall, or children who are too tall for their age. What remedies come to your mind? See, the remedies that you need to keep in your mind as a third year student. First remedy is phosphorus. Phosphorus, phosphoric acid, calcarea carb, calcarea phos, tuberculinum. Few remedies. Who are very tall for their age. Two small components we have discussed. One is the pathogenesis, and the second thing is the physical appearance. So creosote, generally they are lean, thin, tall and emaciated. Very important. Okay, we'll go ahead. Now the third thing we wanted to discuss here is, what do you see here? You see a lot of blood. Now the diathesis, which I have already explained you in the previous class, the diathesis of creosote is mainly hemorrhagic. You see more of bleeding. I'll tell you what it is. You see a lot of hemorrhages. I'll explain the characteristic symptoms. But hemorrhagic diathesis is what you need to remember. Okay. Now this was the diathesis. Which are all the other hemorrhagic diathesis? Okay, good. Many ophidias, crotalus, lacasis, elapse, acids, sulfuric acid. Phosphorus is not over. Okay, no problem. Somebody will do phosphorus, belladonna. Okay, all these remedies. Anyway, we'll go ahead. Now, we are looking at the fourth point of today's lecture, ailments from. What are the causative factors and what will be the effect in creosote? There are three causative factors you need to remember. Okay. The first causative factor here is dentition. Ailments during dentition. We can have some interaction here. What are the other remedies? Ethusa, very good. Podophyllum, chamomilla, cinna, good. Very good. Who was that? What is it? Very good. Calcarea phos. I'll explain. Okay. See, cinna, chamomilla are the remedies that generally comes to our mind when the child is very irritable, when the child is very cranky. Okay. Child is very cranky, child needs to be carried. Fine. Very irritable child. Okay. And you have a combination that the tooth is erupting or the gums have become hard and possibility of tooth erupting out. So complaints during dentition, child is cranky, irritable, think of chamomilla. Complaints during dentition but child is not cranky, think of calcarea phos. You are getting? Trust me, this is how the patient comes to your clinic. Very cranky, very crying, highly irritable, snappish, dentition, chamomilla. Dentition minus all those things, minus all those dramas. No irritability, no crying, no cranky. Then don't worry, don't get confused. Sir, which remedy? The remedy is calcarea phos. Beautiful. I have used in clinics with beautiful results. Okay. Now when phytolacca? When phytolacca? Is phytolacca over? No issues. See, phytolacca is when the child will have irresistible desire to press the gums together. During dentition, during dentition, not once teeth come in. Once teeth come in, you can't get in contact with the gums. So during dentition, when the child is pressing the gums, the remedy is phytolacca. Okay. Now what happens in creosote? What happens in creosote? See, in creosote there is mainly weeping. The child shrieks means the child shouts. Shrieking, crying, restlessness, sleeplessness during dentition. So this is what you have the text here. Difficult dentition, restless, shrieking, irritable, sleepless and crying. You can think of creosote. And must be when I do the particular symptoms of creosote, I will be explaining you more in detail about the dentition complaints. Now we are concentrating on the ailments now. I was referring Dr. Clark's Materia Medica for today's class, and two more ailments given by Dr. Clark is bad smell. Okay, and he also gives ailments from sprains. Ailments from sprain. To be very honest, I have never used creosote for these two complaints because whenever sprains come, we think of Rustox, Ruta, the remedy we spoke in the last class, Netum Cap, okay, Arnica, a lot of remedies come in. So honestly, I have not got a chance to use creosote, and we will try to explore if we will get something when I tell you the particular symptoms. Bad smell, sprains, dentition, 3 elements. Okay. Now we will go ahead. The last component of today's class. Now what do you see here? Okay. See, there is something that is standing out. Fine. There is something that is standing out. So what I wanted you students to understand is, in proving in clinical clinical source, you have a lot of symptoms coming up in creosote. But next few minutes we will be discussing about those symptoms which stands out in creosote. As somebody rightly said, we are going to discuss the characteristic symptoms. The symptoms which are very, very peculiar, okay, very rare, and which is very uncommon. Those symptoms we are trying to concentrate. Okay, uncommon symptoms. Now the first uncommon symptom we have is hemorrhages. Our first peculiar symptom we have in creosote is hemorrhages. Now what makes this symptom special in creosote? Any wild inputs, wild guess why hemorrhage in creosote? Okay. Now the character of hemorrhage in creosote, this is very important. First point is, it is dark. See, there is something called as active and there is something called as passive. So here you have more of dark hemorrhages. Hemorrhages which are brown, black, dark. More than that, this is very, very important. Small wounds bleed freely. Small wounds bleed easily. This is very important. Now from where do you have the bleeding? Bleeding from any orifice. It could be in the form of epistaxis, it could be from gums, fine? Or it could be in the cervix. Okay? A serious condition that can happen in creosote is, after coition, after intercourse, the lady might start bleeding. And from your gynec knowledge, you know that could be a very important symptom of CA cervix. Not everybody, but that could be a small clue for you. Okay, and you may have to investigate her for CA. Right? So it could be from the nose or any wound, small wound. Many times the mother will be surprised. Sir, it was a very small thing, a small prick, but I was shocked with the amount of blood. So that's what we call it as hemorrhagic diathesis. So these patients, these children have the tendency for hemorrhages. Okay, I hope that's clear. So hemorrhages, we have false, we have bell. They are more of bright red hemorrhages. Majority of the ophidias, the acids will have passive hemorrhage. Passive hemorrhage. So the second point, what can you interpret from the image? What do you interpret here? Huh? Very good. What is interpretation? What is interpretation? Fast. So what is it that is fast in creosote? Huh? What is fast in creosote? Meaning the symptoms, the progress of symptoms, they are very, very fast in creosote. Very fast progress. Okay. 10 days back she was diagnosed with cancer. After 15 days she is no more. Now what is this? It's a very fast progress. She had no symptoms of cancer. Okay. Suddenly 10 days back she fell ill. They diagnosed it to be cancer. Next 15 days she is no more. Okay. Now this is what we say fast. Many symptoms in creosote are very fast. Which are the other remedies which will have fast progress? Fast progress. One simple remedy. Yeah, aconate, belladonna. belladonna will have very fast progress. Okay. So creosote is also a remedy which can have very fast progress. Now what is it that is very fast, very rapid? See the beauty, how nicely given in our Materia Medica. Fine. The source books, Allen, Kent, Clark, any of the source books you refer, how beautifully they say, teeth decay as soon as it appears. Fine, you have small kids, 1 year, 1.5 years, 10 months, 11 months, tooth would have come, and next few days tooth has turned black. Okay, now that is creosote. You have patients coming to your clinic with same scenario. Don't miss creosote. Don't miss creosote. And ours is the only system which can do some wonders. At least the further tooth which is coming, if you give creosote, might not turn black. Or which is already turned black, I don't know how much we can make it white. Okay, but at least you can arrest the progress, or you can stop the further teeth going into decay. So teeth can go into decay, and we saw the physical appearance of creosote. How was they? They were very lean, thin, emaciated, and there is something called as emaciation which is very rapid. 15 days back he was so fleshy, so nice, and within 15 days he has emaciated, and the emaciation is going in a very fast pace. You have somebody coming to your clinic like that, you can think of creosote. Okay, and all diseases, even cancer, I just gave an example, they progress very fast. Creosote. Any quick questions? Finding it difficult, or is it clear? Clear? Fine. So two things we spoke. We spoke of the hemorrhages first, and second we spoke how fast the symptoms are in creosote. Because carbons, if you see my lecture, I would have told you, in all carbons the symptoms, they appear very slow. They are very slow. So the only carbon in which the symptoms appear very rapid, fast, is creosote. This clarity I want you to have. Okay. Now moving ahead, Nash Flowers, there is a small book, Homeopathic Therapeutics by E.B. Nash. And Nash is also famous for the last few pages. What is that? Triose, very good. Triose. Creosote is one of the trios of offensive remedies. What is it? Creosote is one of the trios of offensive remedies. Meaning, we have 5,000 plus remedies in homeopathy and hundreds plus remedies which will have offensive discharges. In those 100 plus offensive remedies, see the rating given by Dr. Nash. He puts creosote on top. Which are the other two? Baptisia is right. Which is the other one? It's not arnica. In arnica also you have offensive thing. Hepar also you have offensive. Arsenic also has offensiveness. I have got nothing against arsenic. But as per E.B. Nash, pyrogenum also has offensiveness. Good. But which is the other remedy? One is Baptisia, your friend said. The other one is what I have told you, creosote. There is something in between, and that is murk salt. Murk salt. These are three remedies, top remedies. It can be a viva question for you. Name the trios of offensive remedies. Okay. Now, what is offensive in creosote? Any discharge. I have written that any discharge. See, when I say any discharge, can you give me the inputs? What are those discharges we are talking about? Yeah, it could be, see, you go systematic, it could be from the nose, it could be from the ears, it could be, from the vagina, fine, leucorrhea, okay, or it could be the sweat, or it could be the discharges from the wound. Creosote is a very good remedy for gangrene. The discharges from the ulcers, all those discharges, see, discharge from the mouth, okay, for example, from the gums, pyorrhea alveolaris, so the discharge from the mouth, can be very offensive in creosote. Now, why there is offensiveness from the mouth in creosote? One more reason. What is it? Decay. Very good. Decay of the teeth. Done? Okay, it's all linked. So, the odor in creosote can also be fishy odor. The discharges can be fishy, and the discharges which burn. Fine? The discharges which what is this? Look at the image. The discharges which corrodes. The discharges which excoriates. Okay? For example, in creosote you have discharge coming from the nose. What will happen to the mucous membrane? The mucous membrane is corroded. Okay? The vaginal discharges, the leucorrhea can eat off the tissues there. So leucorrhea, any discharge can be excoriating. Discharges from the eyes. Which is other remedy? Very good. You can't tell it so soft. Whenever I use the word eye and lacrimation, there should be a bang. There should be a sound, The next class student should be worried. What's happening? Euphrasia. See, the voice, the sound talks of your confidence. If you murmur euphrasia, it shows you are not confident. No? So euphrasia, you can also have creosote. So discharges which are hot, burning, excoriating and corrosive. You can think of creosote. Okay. Moving ahead. Okay. Now what you also have here is, animation is not done. Now it's a beautiful remedy for cancer. It's a remedy that fights cancer. Okay. Now what are all the cancerous affections where one can think of creosote? Okay. It can be CS stomach, CS cervix, vagina, or the uterus or the nose. Any of these cancers, I will explain in detail in the next class what will be the indications of creosote in cancer. We will take up in the next class. But under characteristic, you need to remember it's a beautiful remedy for cancerous affections. Okay. Now one more very important thing you also have in creosote is the desires. What exactly a creosote patient likes. What do they like? What do you see here? Smoked meat. What is smoked meat? Tandoor. Anything that is prepared on coal. We have tandoori kebab, we have kalmi kebab, that is typically prepared with coal. So those dishes, creosote likes. Any other remedy that comes to your mind desires smoked meat? Huh? Natrum, more than natrum. See, two remedies you should keep it in your mind. One is causticum. I am talking of smoked meat. One is causticum and the other remedy is tuberculinum. I know both are not there in your syllabus right now, but please do remember causticum and tuberculinum. Of course, creosote. Calcarea phos desires smoked meat. Okay, so these are the desires, and something interesting, the last slide for today. Something interesting you also have in creosote which makes this symptom characteristic. Now what is that? What do you see here? You see a female lying down. Okay, I know that it should be misguiding, there is some slip, kip and all. Somebody would have told, sir, she has committed suicide, she has written something, death note, and then she is lying. I just got this, I know it's an afternoon class. To confuse you, I got this image. But she is alive and she is lying. Okay. Now what I wanted you to understand here is, there is something very characteristic pertaining to the female genitalia. And what is it that is characteristic in creosote is menstrual flow only on lying down. See the symptom. Fine. This is why it becomes characteristic in creosote. Once the lady starts sitting or once she starts walking about, the menstrual flow will stop. And again, when she is lying down, only then the menstrual flow starts. So she has the key. When she wants, she will go lie down. When she says, no, I don't want menstrual flow, then she sits up as either she walks. Okay, now this is very, very peculiar in creosote. Okay, and you will be surprised to see, women coming and talking the same way. And that's when we thank our stalwarts. Fine. Sir, I read in your Materia Medica, lectures on homeopathic Materia Medica, and same thing I am saying. That's why we thank them. Okay. Now one last symptom before we close. This is also very, very peculiar. And if you see this, you understand the amount of importance we are giving here. See the beauty here, it's not only the menstrual flow, a creosote patient can urinate only while lying. Okay? Fine? I have not got a case till date, but does not mean you will not get it. I had a patient very recently. One of my assistants had taken this case, beautifully taken by the assistant. And what was the problem here is, he has difficulty in urination. Okay? And one position he says, sir, standing and my upper body I will have to bend it. Only if I bend my upper part of the body I can urinate. Like all you normal people, I can't stand, I can't sit, and I can't urinate. So if I have to urinate, I have to stand, okay, and bend my upper body, 90 degrees, only then I get to pass urine. We searched a lot for this. We did not get this typical position. But she had beautifully taken the mind and the other symptoms, and he turned out to be a sulfur person. So we gave him sulfur. But what I am trying to tell you is, you will have patients coming with, see, did you anytime imagine somebody can pass urine like this? We always felt we are only normal. Fine? But see the patient, he says, sir, if I can't bend, I can't pass. There are many who come and tell, I have to sit bending back, sit bending forward. There are varieties of positions the patient says, otherwise I can't pass urine. I can't pass stools. Okay. So this is what you need to remember in creosote, that they can pass urine only when they are lying. Okay. So very, very characteristic. Done. So before we close, what we had planned for today, or what I did for today was, we started a remedy named creosote, which is a carbon, or which belongs to the carbon family. And the miasm, very, very important for you, it is predominantly syphilitic, sorosyphilitic. So you see a lot of emaciation. See the speed we were talking of. See the speed also, this speed in creosote is because of that miasm. If it was psychotic, it is like the tortoise, very slow. Many times tortoise is what is compared when we talk of psychosis. Many times rabbit is compared to syphilis, because rabbit is fast. Though in that story rabbit will sleep, tortoise will win, we will not worry about that. But what you have to remember here is, the speed also tells us about the miasmatic background of a remedy. So sorosyphilitic, when anything that is happening fast, rapid, okay, we can think of creosote. Cancer, any disease which is moving very fast. Sir, doctor has told 8 days, 10 days. 10 days back he was absolutely fine, no issues, and we never imagined we will be losing my uncle, my dad, my mother, my father, whoever it is, in such a short span. See the disease progressing. Okay, probably in such conditions one can think of creosote. Okay. And I also shared that case of a gentleman with eczema of the fingertips, beautifully treated with creosote. That prescription was based on the mind, the mental symptom. In the next class, I'll keep that, suspense. Okay, I assume you will think, why did this sir give a remedy creosote to that man? I have given you his mind. So please refer books. And next class, I'll start with you. You tell me, why did I prescribe creosote? Okay. I'm giving you a week's time. You can go refer and come back. Done? So we spoke of ailments, 3 ailments: dentition, bad smell and sprain. We spoke of sphere of action 4. The first one there on the left hand side was mucous membrane. Second one there was blood vessels. Very good. Third was lymphatics. And the last was female genitalia. See, this is how the image should come. Picture in front of you. And we spoke of characteristic. What was the first? Hemorrhage. And what was the second? Yeah, we are here. Fast. And what was the third? Offensive. What was the fourth? Before that we spoke of discharges. Yeah, here. We spoke of discharges which are hot, acrid, burning, excoriating. And then we spoke of cancerous affections. And then we also spoke of desires, mainly for, very good, smoke meat. And then last 2 things which are something common was lying down. On lying down, menses. Only if he lies down, he can pass urine. Creosote. Okay, fast remedy. All other carbons are slow, creosote is fast. I am telling it repeatedly. And majority of the information of today's class are taken from one book, Genetic Materia Medica by Professor Vijaykrishna. It's a beautiful book. I have taken the information from that book. Though I have also referred a lot of other books. Okay, it's a exclusively written, very beautifully written. Okay. So any questions before we close? Any lab? All fine? If it's clear and fine, we can as well stop. Yeah. Chinmay has something. Yes, Chinmay. Okay, very good. Beautiful question. Can somebody help me? Chinmay has a question. Sir, you spoke of this point. The same thing also you see it in allium cepa. Now how do you differentiate allium cepa from creosote? Beautiful question. Okay, yeah, one point. Somebody rightly says offensiveness is not there. Good. I'll agree with that point. And second very important point, Chinmay, in allium cepa it is limited only to nose. See, this is where sphere of action plays a very important role. In allium cepa, for example, if a lady has an acrid leukorrhea, excoriating leukorrhea, we will not think of allium cepa, because allium cepa, the pathology is limited only to nose. Done? And in creosote, the pathology is wide. Allium cepa is an acute remedy. And if you come back here, see, every point we tell has some value. I don't know where it is. Yeah, what is this? First point. Okay, 1 second, give me a. Yeah, see, if you see here, what is it written? Creosote is a deep acting remedy. Okay, and allium cepa is a plant. It's an acute remedy. And the pathogenesis is limited only to nose. Done? And even in nose, what is missing is the offensiveness. If it is creosote, then the discharges will be offensive. And in allium cepa, you don't have offensive discharges. Okay? Anyway, thanks for asking. It's a good question. Any more questions? Yes? Yeah. See, before I showed that I had a confession. What was the confession I made? I checked, but I did not find. So what really happens because of bad odor in creosote, that I don't have. But I have mentioned here because this is mentioned in Clark. And Clark is a man whom we respect a lot. If it is written in Clark, it should be with some meaning. Now I was trying to check, or must be next class I will again check, what bad smell causes in creosote, or sprain, when we think of creosote in sprain. That clarity as on now I don't have. Must be I'll refer and I'll get back to you. Okay. Any more questions? Fine? All fine? Chalo, thank you. Thanks.